What we're gonna do is, I know I'm not gonna touch it, I promise. I know.
You're too close.
Yeah, I'm all up in your grill, aren't I? So we're just gonna do the light, make sure that she can still see. Just a brief recheck.
Here, you need me to
I
hold her?
know. Look at mommy. Look
She's
at
closing her
mommy.
eyes. She said,
Yeah.
you're gonna do something to
She
me.
said, you've stuck so much stuff in my eye, lady. I see your beautiful face. Hi, Queenie. You see me over here? Yeah, you do see me over here. That's a good girl. There you go. Very good. Can you open it a little bit more? Look at Mama. There's Mama's leaving. Mama's leaving you.
How are you doing?
Good girl.
How are you doing?
Yeah. So, you know, just like we said before, there's a lot of really good things going on here. She's got, you know, no swelling, very little discharge at all coming from her eye. She's got a lot of comfort. You want to see if she'll let me stain it just to make sure that we don't have any stain uptake. I don't think we're going to at this point, but that's just good measure. And then we'll talk about your meds and kind of how we want to go moving forward. Okay. Okie dokie. That's a good girl. But she can still see, and that's what's most important. So this is Queenie. Queenie is a 25-year-old female llama that's owned by Miss Vicki. And about, I'd say 6 to 8 weeks ago, she sustained an injury to her left eye. Seemed to be tearing, maybe a little bit of swelling, holding her eye closed just briefly. And obviously, Miss Vicki noticed it and brought her in. So we did an initial ophthalmic examination and looked at the eye just from the outside in and determined that over the past few weeks before, she had sustained an injury to the surface of her eye, which is the cornea. She was already doing the things that you would expect her body to naturally do to fight off its injury. So she had vessels moving across the surface of her eye, which is normal. It's called neovascularization. It's actually one of the coolest things that the eyes do to heal themselves. In addition to that, she had a small abrasion on her cornea that did take up some fluorescein stain, which we're going to recheck here in a second to make sure that that's completely resolved. But the thing that was most concerning about Queenie was that she had this hue, almost like a roughened appearance to the surface of her eye that is characteristic for fungal infections. And this time of the year, it's just the perfect environment. It's hot, it's humid, and fungal spores are everywhere. We have fungal spores that are on our skin, on our hair, in the environment, just floating all around. And so anytime our animals, dogs, cats, horses, llamas, goats, it doesn't matter the animal in particular, anytime there's an injury to the eye, fungal spores can get in there and result in a fungal infection. And that's kind of worst case scenario because they're really hard to resolve. So that was what I was most concerned with when Miss Vicki brought Queenie to me, because when you look at the surface of the eye and you can see her other one, her right eye is actually really clear. And it looks like a pane of glass. It's just really nice and smooth and shiny. Her left eye, when she came to me, it wasn't. It had lost that smooth glass sheen to it. So we were worried that she may have a corneal fungal infection going on. So we immediately started a pretty aggressive regimen of ophthalmic therapies with her, some antibacterial medications, antifungal medications. We pulled her blood and actually spun her blood down to make serum out of it. Serum has a lot of nutritious factors to it, and you can squirt that over the eye, and it actually helps speed up the process of healing for a variety of injuries. So she was on those three.
Anti-inflammatory.
That's right. She was on anti-inflammatory as well, and we hit her with some systemic by mouth pain medications so that she would be comfortable. I'm a wife. I'm a busy mother of 3 beautiful children. I am a life and fitness coach where I inspire others to be the best that they can be every day. I'm also a full-time business owner and veterinarian, large animal veterinarian. I am Dr. Christine McPherson Long, host of Heard This. Come and ride with me, your rural Carolinas large animal vet, as we cover roughly a 900 square mile radius in both North and South Carolina. Every day's an adventure. Over the next week, Miss Vicki did her best to treat this lovely lady, but she presented her own spectrum of challenges with this head and her over 200-pound stature. It's really hard to just immobilize the head and treat it. So when she came back to me after the first week of treatments, Miss Vicki and I decided that it was best to go ahead and place a catheter in her eye. So this catheter is called a subpalpebral lavage catheter, and it's really an interesting tool that we have in our arsenal to treat eyes of any animal. This was the first time I had ever placed an SPL catheter in a llama. However, Miss Vicki was game and I was willing to do it. So we numbed her eye. She stood for us with a light sedative. Again, numbed her eyelids, and we placed this lovely catheter that you can see actually running from the top of her eye here, back over her pole, and then coming down her eye from the top of her head, to this port that's actually right here. Now, the catheter itself was actually long enough to have extended down to her shoulder when we initially put it in. However, unlike a horse that gets these placed, Queenie doesn't have a mane. Yes, she has fleece. Technically, it's fleece. Yep. So it was kind of hard for us to figure out how we were going to secure the catheter in her fleece, if you will. So over time and through Miss Vicki's ingenious MacGyvering of the catheter to keep it stable and flowing, we were able to actually maintain it workable in her eye, shorten it as needed so that it would still function. So she's actually had this catheter placed in her eye for coming on 4 weeks now, which is wonderful. I mean, she lives outside. Miss Vicki is not stalling her. She has good quality of life with the rest of her herd. And this catheter allows Miss Vicki to pass soluble ophthalmic treatments through her catheter. They spread over the cornea, and so she knows 100% that every dose of medication she passes through this port here, it actually goes directly to that eye. So it has completely eliminated any question about whether or not she's getting treated correctly. So from then on, it's just been a matter of figuring out the appropriate treatment regimen to resolve her current condition, which at this moment is a secondary case of uveitis. So she came in initially with a potential fungal infection of her cornea secondary to an injury. We have resolved that, but the subsequent inflammation that was there has resulted in this blueness that you see, which is edema. It's fluid in the tissue layers of her cornea and her eye. The good thing is for the last 2.5 weeks or so, Queenie has been pain-free, swelling-free, discharge-free in her eye, and she is currently still visual. She can't necessarily see a solid object coming at her because it's like she's looking through a pane of opaque glass. However, she can see a bright light, which tells me that her lens is still where it's supposed to be. Her cornea does have some lucency to it, and her retina in the back of her eye is actually picking up the light beams and sending it back to her brain to cause her eyelids to blink. All these things are functioning really, really well. So at this time, she has a pretty good prognosis. Today, what we're gonna do for her is stain her eye. So I've got some fluorescein stain, a pretty concentrated stain that is designed to pick up any abrasion that's on the cornea of the eye. I don't suspect that she'll have any, but it's just good measure when you're doing a recheck ophthalmic exam to make sure that there is no other abrasion. Plus, hopefully today, one of our treatment changes is going to be to add in a steroid into her ophthalmic treatments. Steroids, just like given systemically or over the eye, they suppress the immune system. So she'll continue on antibacterial medication, antifungal medication. She's actually on a very expensive antifungal medication that Miss Vicki, you know, we're hitting her as hard as we can to save this eye and, you know, hopefully resolve any abnormality that is there. So we're going to add dexamethasone into her treatments as long as everything presents well with this stain, and then keep chugging along and hope that the catheter keeps maintaining. Hey there, I'm Christine Long, owner of Pineview Veterinary Hospital here in Bolton, North Carolina. We are an exclusive large animal veterinary practice. We provide 24/7 emergency care and routine services for horses, cows, sheep, goats, llamas, alpacas, and pigs. We are currently a staff of 2 full-time veterinarians, myself and Dr. Leslie Jarrett, and we have a wonderful secretary, Donna Jacobs. We provide veterinary services to the northeastern part of South Carolina and the southeastern part of North Carolina. So if the need arises, give us an opportunity to serve you. Nice, Queenie. You're fine. That's a good girl. I know. I know. You're fine. That's a good girl. I'm getting up. I know. No, oh no goodness. Yeah. Good girl. You're okay. I just need a little bit in there. Good girl, love bug. Good girl. Okay, we got it. We got it.
Now,
I
why
know.
do you make it so hard?
Because I can.
Just open your eye.
Because I
squirt it
can.
in.
That's right. Yeah. Come here. Smush it around. Queenie, you're a mess. You're so good girl. So the stain just smears across the surface of her eye. It's very thin. You can see it change the color of the surface of her eye. The liquid film, her tear film that's over her eye, has the stain in it. So it's turned green, which is normal. And then basically what all we need to do is just look. Yeah, I know, I'm getting all in your face. That's a good girl. You want to open it? Yeah. Her blueness or edema in the eye has actually gotten better every time she's come. That's a good girl. I know. You open it so I can see? You can do it. I like your grass in your teeth. That's a good girl. Yeah. That's a good girl. You're fine. Good girl. Pretty eyelashes. There you go. That's my girl. Thank you. That's good. So just open up her eyelids and see if there's any specific amount of the stain that actually stuck to the eye. And there is none. So she does not have any corneal abrasions at this time, which is great. The abrasion that was there initially, 4 to 6 weeks ago is completely resolved. So with that said, we are going to talk about your meds. So what do you have left over right now, Miss Vicki, for her?
I have
That's a good girl.
the
Ciprofloxacin.
ciprofloxacin.
Yes, ma'am.
And this is the last bottle.
Okay.
But you can see that I still have a number of doses left.
Yes, you
Each
do.
of those are 0.2 cc's.
Yep.
Right.
Okay, good.
And that holds 5 cc's. So
All right. We're going to get you some more of that.
to last for any length of time.
Okay.
And then I am currently on my last bottle of the
Voriconazole.
voriconazole.
Yes, ma'am.
And we have cut that down in half
To point
to
one.
0.1
Perfect.
cc. And with that, because it's so blasted expensive,
That's right.
that the 0.1 seems to be enough that it actually just lays
Kinda
there
cups.
in the eye and doesn't spill out over unless she squeezes it out. And so when she's blinking, that just brings it all up and down her eyeball very nicely. So
And we got some more of that ordered, so it should be
yeah.
ready today, I
We'll
believe.
pick that up later today.
Yes, ma'am. Good. So that's her
That's a
antifungal.
special mixture, because you said that isn't a normal off-the-shelf kind
Nope,
of.
it's a compounded medication. They make it special, a special batch right away for you. So that's great. And that's all she's on right now,
Right.
right?
Yep.
So what we're going to do is we're going to add in the dexamethasone, which is this one. All the bottles look the same pretty much, but
Okay.
this one says dexamethasone sodium phosphate ophthalmic solution.
Okay, and how much
Okay.
are we gonna do each time?
Same thing, 0.2,
0.2?
just like you're doing the Cipro.
Okay.
Yep.
All right.
So this is a stronger medication than the flurbiprofen that you were on initially.
Okay.
Okay.
Does it need to be mixed?
Nope.
No?
Nope.
Okay. And does it need to be refrigerated?
No, ma'am.
Because that fluoroconazole, you keep
It
it in the
does.
dark, you keep
Yeah.
it.
No, that's
in the
ambient temperature. It likes nice 60, 65, 70, up to 77 degrees.
So in air conditioning, which, because here in the South right now, it is not
No,
65, 70 degrees.
that's right. You're so good. I'm very proud of you. You look great.
The rural American lifestyle. It's how we work, and it's how we play. It's how we learn and how we enjoy the finer things in life. How we take care of our animals and tend to the land. It's a way of life. Has been for hundreds of years. Now there's a whole new way for rural America to watch TV.
I love your magic marker. Miss Vicki knows exactly how many doses she has at all times, which is nice because she can call Donna here at the office and request refills of medications, and we know exactly how long they should last. So the catheter here has its own little injection port, and I've just got a little bit of alcohol and I'm just kind of wiping it off here. Miss Vicki does this.
Is that attached to a halter?
The port's attached to her halter now. We've had to shorten it up so many times that this has now been anchored to her halter, which is nice because Miss Vicki can, or Mr. David can grab it and actually hold it just like this without putting tension on the actual rubber line for the catheter itself. So I got 0.2 cc's of the dexamethasone, and we're just going to infuse it right into her catheter here.
See, oh, here.
Yeah.
So it's not me.
And then we push air behind that amount of fluid, and you can watch up here at the catheter, and you can actually see the solution go down. She'll blink. Yes, I know.
Coolest thing ever.
And we know that it's gone right over her eyeball. Yeah. You're just chasing it with 1 cc of air now, aren't you?
Yeah, well, I pull it up and,
Yeah. One's enough to go through the whole line.
yeah,
Yeah. And that's it.
because the line's so short now.
That's right. So,
But actually,
Thank you,
what
ma'am.
just because I actually pull the liquid down,
uh-huh.
okay, then I shake it back down so that there's air in the line behind it on that
Oh,
very
so you
first
kind of an
shot.
all-in-one.
An all-in-one.
Very
And
nice.
then I also chase it with a second, just to make sure that all of it's out through the line.
Mm-hmm.
So because of that, voriconazole
Yes, ma'am.
is so fragile,
Mm-hmm.
I don't want any residual left in the line.
That's perfect.
So,
So Miss Vicki's doing all of Queenie's ophthalmic medications anywhere from 3 to 4 times a day, every day, and waiting roughly anywhere from 5 to 10 minutes in between treatments so that the cornea will absorb the medication that was put over it at that time, do have its effect before we apply the second one. So if all goes well, hopefully next week we'll see less blue than what we have today. It's going away, but this is the first time we've added in the steroids, so we're going to see if that helps speed things up and hopefully not cause any other issues along the way. But that's it. She's done for the day. I don't think she needs to be on any more pain medication systemically.
Okay,
I know
good.
you had stopped the meloxicam by mouth, which is fine. She's not in any pain at this moment. I mean, she squints when she anticipates something coming at her, but she's not in any pain. So I don't think you need to give her any more of that.
Okay, and the injection that we were also giving her, the monster needle.
Yeah, no, don't need that anymore either. So, it says minimal treatment. You good girl. That's it.
Okay.
Queenie and I have learned some lessons through this experience, and I have had llamas since 2004. It's been a learning experience over the years, and I've had Queenie since 2010 when she came to me as a surrender to Southeast Llama Rescue. And so over the years, I started to think that maybe I'm getting a little bit smarter about animals and taking care of them. But this lesson here is that I let vanity and my ego get in the way of doing the right thing. And I'm gonna say that I figured that as old as she is, she's 26 when llamas normally live to be about 20, that she was just getting cataracts. And so I let this go too long. I didn't realize the messages that I should have picked up on. And so the thing that I want to share is that don't let your knowledge get in the way of turning to professionals early on. And the stop points on the indicators were, if you see an animal who is favoring its eye and appears to be in pain, or if there's swelling around the eye, or you see something on the eye, or if it's reacting to light and squinting its eye, get it to the vet early. If I had gotten her to Christine much earlier, Dr. Long earlier, it wouldn't have gotten this far along. And so that is my continuing education in the care of animals. So that was my point.
Are you thinking about a career with horses?
I love this.
We love this.
I love this. I love this. I love this.
We know. You'll love it too.
It's not uncommon for a routine appointment to turn into, let's ask the vet, take advantage of the time. So I hope you enjoyed this episode and gained a lot of information. Appreciate you riding with me today. Thank you for watching.